Today's lecture is on infection prevention and control. एक्चुअल में क्या है हमारे जितना भी हॉस्पिटल में कितना इन्फेक्शंस हैं, थोड़ा सा हम इसके बारे में डिस्कस करेंगे. हाउ टू प्रिवेंट और प्रिवेंशन कैसे कर सकते हैं और हम इनको कंट्रोल कैसे कर सकते हैं. तो हमारे इस सेशन में, इस टीचिंग सेशन में हम इन तीनों चीज़ों के बारे में डिस्कस करेंगे. This session has 3 sections: prevention including the clinical bundles and checklist, control including the precautions, environmental cleaning and disinfection. Section A include C. difficile and MDRO's prevention. In this section we are going to discuss the surveillance and prevention strategies, bundles and checklist. First we will start with surveillance and risk assessment. Surveillance is a keystone of infection prevention. You don't know what are the problems are if you aren't looking for them. आप उसको अगर देख नहीं रहे हैं कि क्या समस्याएं हो सकती हैं, तब आपको कैसे पता है कि ये समस्याएं हैं. तो सबसे पहले हमको पता होना चाहिए हमारी समस्याएं क्या हैं. Once you know what you have, you can define your risk and plan your action accordingly. जब आपको पता है कि ये चीज़ इन्फेक्शन हो सकती है, इसके क्या रिस्क हो सकते हैं, तभी आप उसके अकॉर्डिंगली कोई भी एक्शंस ले सकते हैं. फ्रॉम द CDC 2012 CRE toolkit, in the patient facilities should have an awareness of whether or the non Carbaprim resistant Enterobacteriaceae, that means CRE, at least E. coli and Klebsiella species have even been cultured from the patients admitted to their facilities, and if so, whether these positive cultures were collected within 48 hours of the admission. The patient का admission होना है, उसके 48 hours के बीच में हम क्या करेंगे, उनके टेस्ट को लेंगे और उसके टेस्ट में से इन दोनों ऑर्गेनिज्म को हम ग्रो करेंगे. ग्रो करने के बाद में उनको देखेंगे कि ये ऑर्गेनिजम्स हैं या नहीं, क्योंकि इंडिकेट करते हैं कि इन्फेक्शन इज देयर. नेक्स्ट इज सर्वेलेंस. इफ CRE हैव बीन प्रेजेंट, डिटरमाइन इफ देयर एविडेंस ऑफ इंट्रा फैसिलिटीज ट्रांसमिशन. Which wards unit are most affected, हमें सबसे पहले ये पता करना है. In the facilities don't have this information, consider the evaluation of the quantify incidence, review archived lab result to determine the number and or proportion of the Enterobacteriaceae that are CRE over a specific time periods. Collect the patient's level information to help with epidemiology of the disease. नाउ प्रिवेंशन स्ट्रेटजीज क्या हो सकती है. ये जो पुरानी चीज़ है, तीनों चीज़ों की स्ट्रेटजी हमने रेफरेंस लिया है कि इस तरह की स्ट्रेटजीज़ का हम यूज़ करते हैं. प्रिवेंटिंग इन्फेक्शन रिड्यूस द बर्डन्स ऑफ MDROs, C. difficile. Prevention of antimicrobial resistance depends on appropriate clinical practice in ALL routine patients care, management of the vascular and urinary catheters, prevention of lower respiratory tract infections in the ventilated patients, accurate infection etiology diagnosis, and judicious antimicrobial selection and utilization. What are the prevention strategies? CDC effect. The campaign to reduce the antimicrobial resistance in the healthcare setting is multi-phase phases evidence-based approach with 4 parallel strategies. Infection prevention, accurate and the prompt diagnosis and treatment, prudent use of the antimicrobials, prevention of the transmission. Companion materials are available for the accurate care of hospital, surgical settings, dialysis units, LTCA, Fs and pediatric care units. www ये इनकी गवर्नमेंट की जो साइट है, you can also download the main things from there. Very much important is the hand hygiene. Without hand hygiene, most other measures to reduce the transmission of the bacteria and viruses are likely to fail. Very difficult to guarantee. Compliance is still not close to 100%. In the common theme is all bundles toolkits related to the prevention of Many strategies for the increasing hand compliances exist, and all faculties persist in working to increase the this complaint. द वर्ल्ड हेल्थ ऑर्गेनाइजेशन ग्लव्स यूज पैरामिड, अगर आप ग्लव्स को इस्तेमाल करते हैं तो आपका किस तरीके का ग्लव्स होना चाहिए और कैसे उसको यूज़ करना चाहिए, कैसे उसको प्रिकॉशन लेना चाहिए, यू कैन सी बाय दैट. ठीक है, इफ़ यू वांट यू कैन गो थ्रू इट, अदरवाइज यू इग्नोर दैट. Gloves not indicated. The overuse of the gloves can add it to the transmission. Just think about how many times you have someone's wearing gloves touching all kinds of things before moving to the patient or the patient's environment. We must discourage the unnecessary use of the gloves as much as encouraging the necessary uses. Gloves not indicated. WHO guideline. Gloves not indicated except for the contact precautions. No exposure to the blood or body fluids, contaminated environment. Direct patient's exposure like blood pressure, temperature, pulse, IM, FC injection, bathing, dressing, transporting, care for the eyes and ears without screening or secretions, vascular line manipulation without the presence of blood. Indirect patient exposure using the telephone, writing on the patient's chart, giving role meditation, diverting or the collecting the meal tray, changing the patient bed, moving furniture, placing non-invasive ventilation equipment and oxygen cannulas. Bundles and checklists to reduce the rates of devices associated with the healthcare infections. The number of bundles evidence-based clinical practices have been identified. No studies have specifically demonstrated a subsequent reduction in MDRO's infection and colonization rates, but there is an assumption that decreasing device-associated infection will in the turn decrease the antibiotic use and decrease opportunity to emerge and transmission of the resident organisms. Bundles and the checklist. Clinical care bundles and checklist prevents the HAI, hospital acquired infections, have existed for the many years. These include but not limited to bundles for the prevention of the CAUTI, CAUTI, CLABSI, SSI, VAP, VAE. We will focus mainly on the CAUTI and CLABSI in the today's presentation. CAUTIs means catheter associated urinary tract infection, जिन patients को catheter लगा हो. CAUTIs are common type of healthcare association infection. It represents 15% of HAI reported to the CDC National Healthcare Safety Network. There are estimated 5,60,000 nosocomial UTIs annually. Increased morbidity and mobility. There are an estimated 13,000 attributes death annually. CAUTI is leading cause of the secondary bloodstream infections with 10% of mortality. CAUTI is associated with the excess length of stay 2 to 4 days, increased cost per year nationally, unnecessary antimicrobial uses. CAUTI are the, unfortunately we do not monitor in developing catheters as well we should. Catheters are often placed for the inappropriate indication. Physicians are frequently unaware that catheters.
मम्मी आप बहुत फोन लगाती हो यार, कुछ काम कर रहे हो ना, सब डिस्टर्ब हो जाता है. लेक्चर रिकॉर्ड कर रही थी, बीच में तुमने अपना बजा दिया घंटा. आधा घंटे की मेहनत खराब हो गई. कभी भी किसी टाइम भी बिना बात के फोन करती हो. लेक्चर रिकॉर्ड करी थी, सब बर्बाद कर दिया, आधा घंटे की मेहनत. बोलो. सबसे ज्यादा तुम्हारा फोन आता है, अनवांटेड आता है. जब मैं सुबह काम नई जगह काम करने आई हूँ, मुझे कुछ ना कुछ काम करना होता, बात हो गई 3 बार 4 बार, लेक्चर रिकॉर्ड कर रही थी, तुम्हारा फोन आ गया, बर्बाद हो गया मेरा लेक्चर. फिर कहती हो तुम लेट हो जाती हो. यूजलेस.